Good afternoon.
Hi, doctor. How are you?
I'm great. How are you?
I'm okay, I guess.
My name is Dr. Lauren.
Nice to meet you, Lisa.
Nice to meet you. So, can you tell me a little bit about what's going on with you today?
I think there's something really wrong with my arm.
What do you think's wrong with it?
I think maybe it might be broken.
Okay. All right. Well, I'm going to start with a few simple questions and then we'll get into the details of what had happened to your arm, okay? All right. So, can you please state your full name for me?
It's Lisa ASMR.
I saw that you filled out the health history form online. Has any of your medical history changed?
No, it's all the same.
Okay. All right. Now I have a few standard questions that we ask all of our patients when they come in. So especially with injuries, we just have to be kind of safe. Are you feeling safe at home?
Mostly.
Mostly. Can you elaborate a little bit?
I don't think I should.
Well, I just want to let you know that we have doctor-patient confidentiality in whatever you share with me. If you desire to keep it between us, I will. I just would really like you to be as honest as possible when we're trying to diagnose you. Was this injury alcohol related?
No.
Do you have more than 2 drinks a week?
No.
No? Okay.
I drink maybe like once a month.
What is your marital status?
Single.
Single? Do you live alone?
Yeah, but my boyfriend comes and lives with me once in a while.
Okay, and do you feel safe when your boyfriend stays with you?
When he's happy.
Okay, and did this incident involve your boyfriend?
Yes.
Okay, was he unhappy?
Yeah, I burnt his food, so he was really mad.
Okay, and did he inflict any pain on you?
Well, he grabbed the pan out of my arm and he gripped my arm really, really hard and he ripped it behind me and kind of heard something pop.
Okay, well that's the information that we need to know just so we can understand what type of force was inflicted on your arm, okay? What I'm going to do now is just take some vitals. Could please, I'm going to go ahead and take your heart rate. Oh, silly me. Good. Great. Okay, and now I'm going to check your breathing. Take a deeper breath this time for me. Perfect. So what I'm noticing is an accelerated heart rate. What I would like to do is take your blood pressure next just to see if we're in a great state or if we're in a dangerous level. Go ahead and get this set up for you right now.
Oh, sorry, it's a little warm in here, Doc.
Oh, it's not warm. I just need to make sure that I have my skin exposed and I don't run my clothes on top of you. That is not clean. We like to be clean.
That is important.
Okay. Now that we travel, everything's just kind of everywhere. Okay, I'm going to go ahead and move your sleeve up. I'm going to take your blood pressure on the arm that isn't injured. Is that comfortable for you?
Yes, thank you.
Just have to get up here a little bit to get the right read. Okay. You're sitting well. Just sit nice and tall for me and do not cross your legs. Breathe. Okay, it seems that your blood pressure is a little high, 120 to 90. We'll look into that and just make sure that there's nothing alarming. Maybe in a few weeks send you out for some blood work, okay? Okay. Now let's take a look here. I'm so sorry. There's some damage to your wrist too?
Yeah. He has a pretty firm grip.
So sorry.
It's okay, Doc. I know you're just trying to help.
Just have to get it up a little more to check out everything. Okay. Does this hurt?
It definitely, it's probably a 6 out of. Whew.
Can you lift it?
Yeah.
Okay. Well, I think what I'm going to do, I just see it feels like there's some fractures here, possibly some damage to your wrist for sure. I want to send you over to the medical center. All right, it seems like you have some fractures here and in your wrist. So what I'm going to do is I'm going to temporarily wrap this for you. And I suggest that you go over to the medical center and we're going to go ahead and get that cast placed just for, I think, 2 weeks, just to be precautionary. I don't believe it's broken, but it is fractured pretty heavily, okay? All right, so let me go ahead and wrap this just so you can get over there. I'm so sorry. And I am going to prescribe you just 800 milligram ibuprofen. You just have to take that once a day. I would think that would relieve some of this pain for you. If it's not strong enough, we can look at some other options. I just want to be sure that we steer clear from any narcotics. Keep you safe and happy.
Thank you, Doc.
You're welcome. I also would, if I'm not speaking over my limit and scope, I would like to suggest that you seek some counseling based on the trauma that you've experienced. A lot of times, especially women, we tend to internalize things and ignore issues that we shouldn't. And I just really think that you and your boyfriend would benefit from some couples therapy, maybe to address his anger and find the source, because it most certainly isn't you. It's just some people have some build-up trauma, so you need to decide if that's something that you want to continue to welcome in your life and really address why you allow the behavior. So I would just...
I'm leaving his ass.
Oh, well then.
I don't allow abuse in my home.
Good. I'm proud of you, and if you need any resources, please let me know.
Thank you.
You're welcome. Well, it's a pleasure seeing you today.